Imagine a doctor that never sleeps, never takes a break, and diagnoses thousands of patients within seconds.
What is this? What is this? Hey! What?
Treatment complete.
Sounds like science fiction, right? But the reality is, this is happening right now in medicine. The real question is this AI revolution our friend, or could it become our most dangerous foe? Think about HAL 9000 from 2001: A Space Odyssey, Data from Star Trek, or even Futurama's Bender and the cyborgs from Ghost in the Shell. They all start off as helpful companions until something goes wrong. Today, we're diving into the world of medical AI to see if it's our loyal ally or a potential threat. Stick around, because in the end, I'm going to tell you a shocking real-world case where AI almost got it dangerously wrong. Let's start with diagnostics. Picture this: you're feeling unwell, so you log into a telehealth app, and within seconds, an AI assistant reads your symptoms, reviews your health records, and gives you a diagnosis based on data from millions of cases. Much like the all-knowing systems in Star Trek, or even the predictive technology in Akira, today's AI tools in diagnostics process data at lightning speeds. But there's a catch. Unlike sci-fi, AIs that seem intuitive, these real-world systems are only as good as their data. If the data is biased, then the diagnosis potentially could be as well. In fact, research shows that AI systems in healthcare have shown racial and gender bias due to biased training data. We've already seen examples of bias in healthcare AI. So, is AI truly helpful in delivering fair, unbiased care? Or could it actually potentially deepen disparities? Now, imagine a surgery so precise it surpasses human capabilities. Robotic-assisted surgical devices like the Da Vinci system allow operations with millimeter precision. In Star Wars, droids performed surgeries without human error, while in Westworld, robots repaired other robots in endless cycles. But in the real world, we use robots to assist, not replace human surgeons. The big question is, how much control are we handing over? If a robot makes an error in the operating room, who's responsible?
It's not me!
Imagine being on that operating table. Would you trust a robot to perform a potentially life-saving operation? AI is transforming patient care, from managing logistics to acting as digital nurses. Imagine a compassionate AI at your bedside, something like Neon Genesis Evangelion's Ritsuko, overseeing the Ava pilots, or even Cowboy Bebop's bioengineered tech. In Futurama, Bender may not be the ideal caregiver, but sci-fi shows like Evangelion and Ghost in the Shell have presented AI with more compassionate sides. In reality though, relying on AI in patient care raises real ethical concerns. Does it risk removing the human touch? And what about privacy? How much personal data should an AI have access to? Privacy is crucial in medicine. The more we rely on AI, the more data we feed it. Research has raised concerns about data misuse and the potential for AI to infringe on patient privacy. So where's it all going? And who has access? Now, full disclosure, at Dynamo Health, we are also on the cutting edge of AI technology in healthcare. In fact, right now, we have an AI that's publicly accessible on our homepage at dynamo.health, and it's doing pretty cool things. Full disclosure, behind the scenes, we are working hard on the next generation of AI, things known as AI agents, which will be able to act in such a way that they could potentially replace human beings. This is the future of healthcare, and we're doing everything we can at Dynamo Health to stay on top of the future trends. But I'll tell you guys, early on in the development stages of our AI, I learned firsthand that we have to be careful. I chose to train our AI using books and resources that I respected and really grew my medical knowledge on through my training. And early on, I made it a point to ask the AI questions and see what it would tell me. And right from the start, I noticed that under the right circumstances, AI could give you some excellent information, but there were times when it would spit out information that I knew was incorrect. The strange thing was that information wasn't from the sources it had been given, at least not in the way that it had repeated them and the answers it had given. What I learned early on is that AIs are crucially dependent on the data and how they process it. And it is important that a real human being is there to verify and manage all of the information coming out of the AI. Now, this was early on in the stages of development of AI in our company, and it didn't cause any real world effects, but that was a real world case where I learned about the potential dangers of AI and the need for care and the human touch as we figure out how to incorporate AI in medicine. I invite all you guys watching this video to head over to dynamo.health and take a peek, interact with Dynamo. That's what we're calling him. Let us know what you think in the comments. Now, all this brings us to the core question: control. Who's really in charge of these powerful AI systems? HAL from 2001 went rogue to protect its mission, while Westworld and Ghost in the Shell explore what happens when AI begins to question its own purpose. It sounds like a sci-fi nightmare, but AI is advancing so fast that some researchers are calling for kill switches, emergency protocols to prevent AI from going rogue. So, is AI in medicine a friend or foe? The reality is, it's potentially both. AI holds the potential to save lives and make healthcare more accessible. But with that potential comes risk. The risk of overdependency, privacy concerns, and control issues. The key will be how we choose to use this technology and what boundaries we set. So let's hear your thoughts. Do you think AI will open the key to the future of healthcare, or are we potentially opening up Pandora's box? Let us know in the comments below. As always, guys, stay dynamic. I'll see you in the next one. Peace.